Oh, hi. Welcome to my inaugural YouTube video from the Healing Collective. My name is Dr. Marty Bloch, and I'm talking today about natural treatments for colds. This is not flu. Flu is a little bit different. I think it's appropriate because we're moving into the winter and people will be coming down with colds pretty soon. First, I'm going to talk about some of the nutritional and herbal treatments, and then the homeopathic treatments, because my passion is homeopathy and I really enjoy it and find it effective for lots of ailments. First of all, what is a cold? A cold is a viral illness that lots of people get, and people often think it's from sneezing and that they're airborne, but the way the virus is really spread is that the person sneezes and it lands, for example, on a doorknob or a desk, and then the next person comes along, touches it, and at some point brings it near to their mouth or nose, and they then come down with the cold. So one of the important things during the cold season is to wash your hands frequently, and also if you have a cold or your family members have a cold, to go ahead and clean the doorknobs and wipe down flat countertops. Probably the most famous holistic treatment for a cold is vitamin C, and it actually works pretty well. There are prophylactic doses, meaning that you can take it to prevent cold, and that is relatively low, 500 to 1,000 milligrams a day. However, when you get a cold, the appropriate amount is actually taking it to, quote, bowel tolerance. If you take a lot of vitamin C, you'll start to get diarrhea, so you want to take the amount just below that. Some people will arbitrarily say 4 or 5 grams per day, but it can be more than that. Another popular remedy for colds are zinc lozenges. The lozenges have been shown to work, whereas zinc supplements in pills that you take in your stomach don't actually work as well. Perhaps it's because the zinc acts locally within the mouth and the nose to prevent the virus. There are 2 ways of taking them. One is to take a zinc lozenge every 2 to 3 hours while you're awake. The other is to break them into small pieces and just let it melt in your cheek over a period of time. And it turns out if you do that, you may actually have fewer per day that you're using. But that works pretty well. Honey is often used. I don't think honey's been shown to decrease the length of colds. However, it has been shown for parents that it helps with the sleep of the children, and so both the parent and the child do better when the child is getting honey. But we all know how wonderful it feels to have honey in your throat and how wonderful it tastes. So don't be reluctant to have honey with tea when you're having a cold. Of the herbal remedies, echinacea is probably the most well known. However, the studies haven't borne up that echinacea shortens the durations of cold. Perhaps that's because when herbalists have used herbs, they rarely use them in monotherapy. They rarely use one herb at a time. The tradition has been to put a small amount of this, small amount of that, turn it into a tea, and take it that way. So echinacea has not really been shown to help when used alone. However, I personally do use something called Kick-Ass Immune, which has about 7 or 8 different herbal treatments in it, including echinacea, golden seal, and cinnamon. The one herb that has been shown to be beneficial alone, and I've also used with effect on myself and my patients, is elderberry. So that comes in both syrups and lozenge and works pretty well. While I was researching this for this little presentation, I heard about a new heard about something new, which is cod liver oil. Cod liver oil has been shown to shorten the duration of colds and flus. It's thought to be due to the vitamin A and D. I do take cod liver oil myself on a regular basis, and I was looking at the amount of vitamin A and vitamin D in my cod liver oil compared to the presumed therapeutic dose, and I think I would have to take 8 or 10 teaspoons per day to get to that. So I don't know if that's going to be one that I'm going to adopt, but cod liver oil in general is healthy for people, and maybe something to keep in the back of your mind. Apart from herbs and vitamins, there are some things that you can do that are supportive, which will help you feel better, may or may not decrease the length of the cold. This includes gargling with warm salt water, and then neti, which is basically gargling with the nose. I don't know if you've seen them before, but they're these little pots like this with a spout that you can get at any pharmacy now. And I just mix salt with warm water and then have it drain from one nostril into the back of your throat. It's very soothing. There is a company that sells little sachets of salt that are half salt and half baking soda, and pre-formulated for the size of the pot. Otherwise, you could mix salt and baking soda and do it on your own. That can also be gargled. Broths and soups are supportive, will help you feel better, particularly with aromatics. By aromatics, I mean herbs and spices that have a lot of flavor to them. So in the Oriental vein, things like lemongrass and ginger, and in the more Western vein, things like rosemary and oregano in high amounts. As I said at the outset, my passion is homeopathy, and I like to use homeopathy on myself and my family. I divide colds into 3 phases. I've never heard in medical school that that's how they are, but that seems to be my experience and a lot of people's experience. The first phase is when it's first coming on. The second phase is kind of when it's ripening, and the third phase is when it's going away. So I'm going to divide the remedies into the different phases, as it were. So in phase 1, there are 4 remedies that are commonly used. Those are aconite, ferrum phosphoricum, dulcamara, and nux vomica. So ferrum phosphoricum is the one that would be used the most. That's when somebody doesn't really have a high fever, maybe not anything distinct that brought it on, but maybe feels flushed in their face, a little bit warm, but not a high fever. That would correspond to ferrum phosphoricum. If the illness comes on shortly after exposure to cold and dry, particularly a cold and dry wind, that would be aconite. Go ahead and take aconite for that. It may be associated with a burning throat, and if it's a child, it might be there might be fear or nightmares that come along after the exposure to cold and dry. With the change of season, we're a little bit past that in Colorado currently, but from the change from summer to fall, that would often correspond to dulcamara, and that's associated with watery discharge and running nose that's worse in a warm room. A lot of people know nux vomica as a remedy for when you're feeling toxic, often maybe after drinking too much the night before, that sort of toxic feeling, but it is also used in colds and flus, particularly at the start of it. One of the symptoms is irritability, so if the person's irritable or has a spasmodic cough right from the outset, those would be good indications for it. So those are the 4 homeopathic remedies commonly used at the beginning of a cold. The second phase is a lot more variable, and I was going to talk briefly about 6 of those remedies. However, there are even more. If you want to make it simple on yourself, there are combination homeopathic remedies that are designed for colds that might have 8 or 10 different remedies, and they're likely to have many of the ones that I'm about to list. So one way of approaching it would be, cold comes on and you have an etiology, for example, exposure to cold. You go ahead and take the aconite, and then you could take the combination remedy in the middle, along with some of the other herbal things that we spoke about. And towards the end, there's another remedy, Calite bichromicum, that I'll come to. But the six common homeopathic remedies for the middle stage of a cold are allium cepa, that's made from red onion. And you know, if you've ever been chopping an onion, you know you get a lot of watering from your eyes and nose. So if you have a lot of watering from your eyes and nose with a cold, particularly if there's burning at the lip from the discharge, that would correspond to allium cepa. Euphrasia, which is eye bright, is also commonly used. Once again, there's a lot of discharge both from the eyes and the nose. In this case, however, there's more eye pain or eye burning than the nose. Bryonia is commonly used in colds. Bryonia has a couple of what we call keynote symptoms for it, strong symptoms. One is that the person is worse from moving. So this is often if a cold is getting into the chest and the person's developing pleurisy and they cough and have to grab their chest. They also tend to want to be left alone and are thirsty. Natrum muriaticum is a very common homeopathic remedy for colds. The main thing about it from a physical standpoint is that the nose gets stopped up with discharge that looks like the white of an egg. We call that albuminous. So the person might have sneezing and then development of a stopped nose, like the white of an egg, and with that loss of taste and smell. And one of the things about homeopathic remedies is that they often come along with mental and emotional symptoms. So if the person is worse from sympathy, meaning you come along and say, oh, I'm sorry that you're feeling so bad, and they're like, just leave me alone, that would go along with Natrum muriaticum. Pulsatilla is a common cold remedy that occurs particularly in children. Instead of having an albuminous discharge, white of an egg discharge in the nose, you'll have a bland yellow one. It's possible that you'll have a yellow thing going in and out of the nose, for example, and that person tends to be wanting sympathy, whereas Natrum muriaticum was opposed to it. Interestingly, the discharge and the general feeling of the person can be better outside in the open air, and they tend not to be thirsty. So the child might be having a fever and you're thinking drink, 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 and they're refusing the water or tea, and they've got a yellow thing coming in and out with each breath. Think pulsatilla. The last of the homeopathic remedies I'm going to mention in the middle phase is Arsenicum album. I know this one well because this was the first homeopathic remedy I took. When people need Arsenicum album, they're thirsty and can be restless, tend to be worse at night. So when the cold is worse at night, some interesting things about it is that there are burning pains that are better from warmth. So if you're getting burning in your throat, restlessness and the burning is better from drinking something warm. That would be a good indication for arsenicum album. The final remedy I would like to talk about is calibichromicum. I've used this tons. It's the common thread towards the end of a cold. So you know, after you've gone through the prodromal thing in the cold and you're starting to feel better, and maybe going back to work or school, getting your life back in order, but you've got this cough where you cough, 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 and then something comes up and you feel like, oh, I can breathe. Or maybe it's in the nose, you feel that there's something stuck in your nose and you blow your nose, something comes out, and then you can breathe, but then 2, 3, 4 minutes later, it feels like you have that again. That's calibichromicum. Before we talked about the discharge looking like the white of an egg or bland and yellow. This one is gooey. You can actually, if you have it, you can actually stretch it. And so that's calibichromicum. Works very well to move the cold out. Thank you for your attention.